healthcare costs at work are set to steeply rise in 2024. There are no Americans working in the healthcare industry anymore, by the way. I know, I see it every day.
Mm-hmm.
I would say 95% of the workers in American healthcare today are foreign nationals. You don't see Americans in the healthcare industry anymore in the United States of America. The cost of job-based healthcare coverage for 2024 is expected to rise at its fastest pace in years as inflation pervades insurance policies. One of the other things they do is they get you on the copays. Maybe you had a $20 copay before. I remember having like a $15, $20 copay. Now your copay is $500, $1,000, $6,000 in some cases.
Well, a lot of
and
them.
I'm citing this from cases that I've worked on.
Yeah. A lot of times there's a certain amount you have to go beyond that you pay out of pocket before insurance kicks in.
That's copay.
Yeah. And that gets pretty egregious.
Yes, it is now.
Yeah.
It absolutely is now. I've seen some brutal stuff. The insurance companies are designed, by the way, to not pay you. That's why there is an entire practice field in law that just deals with the insurance companies because it's so egregious.
Yeah.
But then the other problem is the medical providers, your physical therapists, your medical equipment providers like back braces and heating pads and that kind of thing.
Yeah.
They mark stuff up 400, 500, 600, 700%.
Because they know insurance is going to cover it.
Because they know that insurance is going to cover it, and it becomes an ugly death spiral of the insurance company not paying.
I made this observation when my dog, when I was married, got attacked.
Yeah,
tore up pretty good.
Mm-hmm.
And I took him to the vet, and I'm like, this could be a $4,000 medical bill. It was like $400. Stitches, tetanus shot, antibiotics, the whole deal. If a human, if that had happened to me and I went to the emergency room, 6 G's.
Probably
6 G's. That was back in
so a couple of months ago, our shepherd dog got a beef bone stuck on his lower jaw.
Uh-huh.
And we couldn't get it off because he was not having it, first of all.
Uh-huh.
So we had to take him to the doggy hospital to get it taken off and everything. $600.
Wow.
To have the bone removed.
Jesus Christ.
From his lower jaw because it got stuck over his canines.
Yeah, well. I mean, yeah.
$600
Yeah. My dog needed 18 stitches.
Right.
I mean, he was bit on the nose pretty bad.
Yeah. Here's an upside for you. I will dispel a myth. Like I said, I work in the particular industry right now. Everybody talks about ambulance chaser lawyers. Turns out they're the only thing standing between you and the insurance companies. And when they get their fee, it comes out of the insurance companies. It's your losses, your compensation, plus an interest that is calculated by state law, and then the lawyer's fees. They don't take anything at all from you. And most of the people in the United States think that the ambulance chasers take their money out of your winnings, your earnings from the case. It is categorically not true. They take nothing from the individual. They take that from the insurance companies. So at least that's a good point.
Yeah.
So
this is just getting insane. And it's not helping the fact that we have millions of people in this country who are literally nothing but a drain on our resources. They are not, there's no value added.
There's more than one group too.
Yeah.
It is categorically more than one group that is doing this.
Yes. And I said millions because I didn't want to get into
it. It is millions.
It's millions of people. Yeah.
It is millions.
This is going to turn into like one hell of a
actually
chaotic bloodbath.
Tens of millions at this point.
Yeah. Like somewhere around 33 million.
Somewhere around there. And it also includes one of your favorite groups, the horizontally orientated entertainers.
The whoas?
Those garden implements.
Yes.
They are a large drain on this industry.
Well, let's just be honest. I've already done this math so many times.
Yeah.
Single mothers literally provide or seldom ever provide any value added. All right. Now, I'm not talking about the single mother doctors or the single mother dentists or the single mother, high profile.
Basically, the cottage industry of being a single welfare mother.
Yeah. If you are on WIC welfare and Section 8 and you're getting child support and whatever, you are not adding to the economy. You are a drain.
You are what's known as a net negative.
Yes. And a lot of people don't seem to understand that the child support that's collected by the county is usually reimbursed dollar for dollar out of Title 4D money, which is funded out of the Social Security Fund.
Yep.
So when you can't retire in 10 years from now and Social Security goes bankrupt,
Yep.
you can put that right on the single mothers.
That is already going to be a thing. And the single mothers were very quickly eclipsed by our biggest growing demographic, the welfare invaders.
Yes.
Which we will get to in just a moment. Workers will learn just how much more they'll pay during their employer's open enrollment period, which typically takes place at this time. This year, employees are shelling out an average of $6,575 for their share of the nearly $24,000 annual premium for a family policy, and just over $1,400 for their share of the $8,400 cost of single coverage. So you're going to be paying close to $500 or more per month just to have health care at all. And if you're relatively young, you don't need it.
Yeah.
For the most part.
Yeah. Well, I mean, let's face it. I didn't really need any type of actual medical stuff on the regular until I got north of 45.
Yeah.
I mean, I was wounded a couple times. They took care of me. I healed up. I was fine. But, you know, right around 42, 43, I started having to take high blood pressure medicine because it runs in my family. I've noticed some other issues, and it's just one of those things. Once you get over 40, you're no longer going uphill. You're going downhill. And at the bottom of that roller coaster, no matter how turbulent or calm it is, you wind up in the 6-foot deep hole because gravity always wins every single time.
True story. True story. And
And
there just comes a point where your youthful healing powers
doesn't happen.
Those are powered by years, and at a certain point, you run out of years.
Yeah, and we're there. You and I are there.
We're both there. I know.
Yeah, we're both there. And like my mother, like she's 78.
Yeah.
And thank God she got really good medical care, so she'll live hopefully to 80 and beyond. We'll see.
Mm-hmm.
But if the medical care wasn't around, she would have died about a year and a half. No, she would have died 5-7 years back with the battle of cancer she had. She had lung cancer.
Yeah.
Yeah, that would have finished her off inside of 6 months.
I forgot that you beat that.
And she beat it hard.
It's a fucking tough one.
Yeah,
that's a tough one.
She is. She's just a mean cuss. I'm just gonna be honest.
That's that generation. My mother's the same way.
Yeah,
my mother is the same way. There's no.
I love my mom, but
yeah.
you get her spun up and shit happens.
Yeah. Well, here's the thing. There are multiple reasons why healthcare costs are rising swiftly now. The North American Chief Actuary for Health Solutions at Aon, which pegs the increase at 8.5% for 2024. Brace yourself. If you have health insurance, your costs are going up. Okay. I'm sitting here in the industry telling you that. Higher prices account for more than half of the jump. Though inflation hit its peak last year, how do they know that it hit its peak last year?
They're lying.
The impact is often delayed in the healthcare sector because contracts between insurers and medical providers are usually locked in for several years. That is true. Even though inflation is subsiding, the healthcare trend is growing as medical providers push insurers for larger cost increases to cover the higher cost of wages and supplies that they endured during the last couple of years but were unable to pass to the taxpayers. Because we're going to go after the vice presidential debates, I'm going to go a little faster through some of this than I originally planned to. But your health insurance and car insurance and everything else, point blank, is going up because the drain on the insurance and medical industries from the welfare invaders that come in, and every time a new invader comes in, that individual gets federalized health care, an EBT card with cash allowance, and some of them apparently we've seen stuff where they're getting like $13,000 worth of EBT and $5,000 in cash of your money. That's your money. that's being given to these illegal invaders that are flooding into the country. Every one of them is getting this healthcare and stuff. And the healthcare industry, the insurance industry, they can't absorb the cost. So guess who gets it?
That's right.
You do. Guess where you get it? Bend over.
You're getting your business slips punched.
Nobody's buying you a drink. Nobody's buying you dinner. Just bend over.
That's right.
Because the federal government's about to stick you in
the brown eye.
Bad.
Yeah. It's not a ribeye.
Bad poke.
It's not a ribeye. It's a brown eye.
Bad poke.
And the dildo of consequences rarely shows up lubed.
Insurers' proposed rate changes, most of which fall between 2 and 10%, may change during the review process with the ACA. Although the vast majority of marketplace enrollees receive subsidies and are not expected to face these added costs, premium increases generally result in higher federal spending on subsidies. Allow me to translate this for you. If you have a job and are a normal person and are a standing citizen who pays his taxes, pays his mortgage, pays his bills, and pays his insurance, you're going to get done in the butt. The subsidies all go to the illegal aliens
and
the invaders
and the single mothers
mm-hmm. and a certain segment of the urban population that has a proclivity for ending up on EBT and Section 8 housing. I have seen individuals of specific groups of ethnic descent who I get their paperwork and they got to have all of their bills and I got to know what everything is. It's just part of the legal process. And they'll have like a $1,400 rental 2-bedroom apartment, right?
Uh-huh.
Client's portion, $53.
Wow.
And the state
pays the rest.
You pay the other $1,300. You pay the other $1,350 of that individual's rent.
And that's Section 8.
Yes.
Yes.
Yep. And they're not in terrible neighborhoods.
No. I was actually tempted about 10 years back to purchase a bunch of homes and put them under Section 8.
Yeah.
And I just didn't want to deal with the headaches.
It would have been ugly headaches.
Yeah.
First of all, your properties would have been destroyed in relatively short order. Because they don't have any responsibility, because they've got no skin in the game, they just destroy the places.
Yep.
They just completely destroy it. We've seen we have process servers. We have guys who have to take paperwork to these people's houses, and the guys will come back shaking their head going, "You're not going to fucking believe this."
No, I was actually talking with a guy who used to own about 15, 20 properties in Wayne County.
Yeah.
And he literally, one of the properties, he had to have it condemned and bulldozed because it was absolutely wrecked. We're talking 6 foot high, 6 foot high piles of dirty diapers outside virtually every window.
What?
Yeah. And he's just like, it was so disgusting.
Oh my God.
That I'm literally like, just bulldoze the whole fucking, burn it into its foundation, and then we'll scrape up the fucking ash. It was terrible.
That's terrifying.
And I'm like, I don't think I want to do that.
That's
good.
Terrifying.
I don't need to get involved in that shit. Wow.
And for every additional fornication trophy produced, they get more money.
Yes.
As well. And that's also the welfare illegals are doing the exact same thing. The welfare invaders.
And it's only going to get worse too, because our reproduction rates are below replacement. So the government
we went over that. No, they're not. That's gaslighting.
I'm just saying, at some point, they're going to start trying to incentivize people to have yet more kids that are going to wind up in prison.
Yes, I agree with that. Our population, the Caucasian American population, is exactly where it should be. We went over that in that whole episode. Is it immigration evasion?
Yeah.
Is that what we called it? Our numbers are exactly where they should be. The problem is they just keep dumping more and more third worlders on top of us. So it looks like our numbers are going down. Our numbers are fine. They're where they're supposed to be for this time period. That's a whole other rabbit hole. I don't want to go down a whole other rabbit hole right now.
No, we're not ready for that.
Insurers say healthcare costs will jump in 2024. There's more evidence employers should brace for higher health costs in 2024. A pair of new surveys finds that U.S. health costs will jump in the new year, which may have significant implications for organizations. According to WTW's Global Medical Trends Survey, the cost of medical care benefits in the United States is projected to increase an additional 8.9% in 2024, compared with 8.2% in 2023. Globally, though, the cost increase will ease slightly to 9.9% after hitting a record high of 10% in 2023, although analysts predict it will increase again in the coming few years. Basically, what they're doing is bracing you to take it in deeper again.
Yeah, take it deeper.
Yeah.
And bigger.
Because this is 2024. This is right now. This article is from the beginning of the year, and we've already seen costs go up. I'm sure that some of you have gotten your health insurance bills and gone,
what the fuck?
The fuck.
Yeah. Correct.
So when 2025 is just going to get worse because spending has completely overridden all of the markets. They're just spending too much money.
And did you hear
on free healthcare?
You listened to the Kennedy when he talked about the massive healthcare crisis we're going into because everyone's getting chronically ill.
Everybody's being poisoned.
Yeah.
Everybody keeps eating shit and taking the medicine that their doctors give them.
Yeah, it's not like the medical industry finds permanent cures. They just treat the symptoms.
We're going to do a show on that. Welcome to the subscription of your life.
Yeah. Well, here's the thing is I have been doing a lot of research because, I have some issues going on.
And you do mad science experiments in your fucking bathroom.
I know.
I've seen it. I've walked into your bathroom and seen like bubbling cauldrons of liquefied metals next to supplements. And I'm wondering to myself if like you're the T1000. So,
but the thing is the seed oils.
Yeah.
All right.
Yep.
When you look at the amount of seed oils that are getting used, you can literally see the seed oils increase, and then you can watch the health problems go up with it.
Yeah.
It's like, what the fuck?
The other day on a whim, when I was little hostess, when we were kids, fucking love Twinkies, dude. Love ho-hos.
Little Debbie was my girlfriend.
There you go. Little Debbie was your girlfriend. I love the Hostess pies, the apple pies.
They're okay.
That was my thing.
Yeah.
But the other day, like 2 days ago, I happened to look up the ingredients in Twinkies, which is a simple yellow cake with a frosting. First of all, there's no frosting in there. That's just hydrogenated seed oil.
Yep.
With sugar. There are 37 ingredients in a Twinkie. And I sat down and broke it down because I like to cook. I'm that guy. And you can make a Twinkie with 7 ingredients, including eggs, raw sugar, real vanilla.
Yeah. The stuff that should be in there.
It should be in there.
Yeah. Now, listen, I'm going to be honest. I was one of those guys who would have the orange Hostess cupcakes in a Red Bull.
Yeah. That's a meal.
I can't tell you how many times that I'd have people come to my desk at lunch. They come in with their meal or whatever. And I'm like, that's bad for you.
Yeah, yes, it is.
And now I'm paying for it.
Did you have vending machines in your barracks?
We did.
We had vending machines in many of the barracks that I was in.
Yeah. Listen, there's so many fucked up stories.
So many.
Because, you remember
it's all poison.
The vending machine in office where they put that dude's shit in there? We've did that to quite a few soldiers.
Yeah.
Like, where's my wallet? My dog tags. Q1 in the vending machine. Gotta get out there and buy that. What? That's so fucked up.
Yeah, I've seen that happen more than once.
Yeah.
Don't leave your shit insecure in a barrel.
No,
something bad will happen.
Get fucked up. All right, we're off the wire.
We're off the
target. Off the target.
The drivers of medical costs, according to insurers, range from new medical technologies to overuse of care due to medical professionals recommending too many services or over-prescribing. This is the subscription to your life. The thing that the doctors are doing today, the doctors are basically just drug pushers at this point.
Yeah.
All they want to do is get you on your subscription of medications so that you are a customer for life.
I miss my KGB doctor. Like literally, I would go to his office.
Yeah.
It was all one. You need
I love the KGB doctor.
You need a scan of your heart. Just go down two doors down on the hallway, and the Russian nurse comes in and EKG, no problem. EEG, they had that machine. I didn't have to like, all right, we're gonna give you a referral. You got to call this guy, and it's a month or 2 months.
Yeah, I deal with that also
I
on
fucking
a
hate
daily
that
basis.
shit.
Yeah, I deal with that constantly.
Hmm.
There are driver services just for the medical industry, exactly for that reason.
Yeah.
There are 4 major driving services in the Detroit metro area just to shuttle patients back and forth between referrals.
Like my buddy Darren, his bed used to be right there.
Yeah.
Right where that desk is
Yeah.
in front of you.
Yeah.
And they had him on a fentanyl patch because he was always in pain because of his leg. And about 2 years before it passed away, the insurance company's like, we're done covering it. And they cold turkeyed him, and that almost killed him.
You can't. Wow.
Yeah, you can't do that. They got away with it.
Wow.
And there was supposed to be a settlement, but he died before it finished in court. So there you go.
Wow. That's crazy.
And listen, that happens all the time.
Yeah, I see that as well. It's all the stuff we're talking about with the medical stuff, I see pretty much on the daily. Insurance companies just stopping payment. They're not going to cover you anymore. You're done. And they'll
you have to go to court. You got to go through the whole thing.
Yes.
And then
it can take years. I've got probably 7 or 8 dozen cases that are 2, 3, 4 years old. Well, maybe not 4 years old, 2, 3 years old.
Yeah.
I'm not a lawyer, by the way. I'm a paralegal. Big difference. Not here to give legal advice. Have to make little disclaimer. This is not legal advice. Find a lawyer.
Yeah.
There.
Yourself. We're not recommending anyone.
That's right. Inflation continues to be a factor as well. Although inflation has abated in recent months, it's catching up to medical costs as the price of gas, food, and other goods and services increases due to inflation. Medical trend factors used by insurers to set premium rates have clearly been incrementally affected as well. Again, this is the whole EBT invader problem that is driving the prices through the roof. I see it on the daily.
It's supply and demand, right? It boils down to simply this: supply and demand. We have X amount of supply, and now we have over demand.
Well, the thing is, they've created an additional supply made entirely of monopoly money.
Correct. Well, here's the thing, though. You have the demand, which is now greater, and you have a limited supply. If you want to get your hands on that supply, you got to pay more money.
Yeah.
And it's not helping that, we've basically doubled or tripled our money supply in the past 4 years because we're printing more money than this is why our money isn't like so hyperinflated. It's worth just a fraction of what it was. Is beyond me.
It is.
No, I'm talking about like it's cheaper to burn
like
the money
Weimar
to heat
Germany
your house.
Period. Yeah, Weimar Germany period.
Yeah, or
inflation.
was it
Venezuela?
Zimbabwe, Venezuela? What?
Zimbabwe, Venezuela. Yeah.
Like there's people who get money, weave it into clothes, and sell it for more than the value of the money you made the clothes. This is like bizarro, crazy retard land.
Yes.
Wow.
Yeah, it's gotten.
And
really
listen,
weird.
I'm not a super economist, but I understand how shit works.
You're the math guy.
Yeah.
I can do the analysis part, but you do the math part. So this article is from 2024, but here's health expenditures from 1960 to 2022. Now, this is in US billions of dollars. Look at right around 1996. I wish Mrs. Battledwarf was here. She knows all of the drug stuff. She knows all the drug stuff.
Yeah.
I think it was around 96 when the insurance companies were allowed to start advertising on TV. Look at the climb right there.
Mm-hmm.
All of a sudden, there's medical expenses out the ass.
Out what?
Out the ass.
Okay. Yeah.
Insurance pays medical providers for quantity, not quality. Most health insurance companies, including Medicare, pay doctors, hospitals, and other providers using a fee-for-service system. This is true. Again, deal with it on a daily. This method works by reimbursing each test, procedure, or office visit. They keep immaculate bills at all of the healthcare providers, your physical therapist, your MRI, your medical device provider, all of that stuff.
Yeah, look, my sister does a lot of that billing and negotiating with the insurance companies.
Medical billing coders make good money.
She makes like 45. Not that good of money.
Well, I mean, it doesn't for the job that it is.
Yeah, you're right.
For the job that it is, it's not that difficult.
And that pay it's just a guess.
Mm-hmm.
I don't really know. I don't talk to her, so I don't know, and I don't care actually.
Yeah, that's fine. The more services doctors provide, the more money they receive. This can lead to excess testing, over-treatment, or over-prescribing. Can vouch is true. This is particularly true for patients in poor health with a low chance of improvement. Additionally, the U.S. healthcare system is non-integrated. The World Health Organization, the WHO, which is absolutely evil and diabolical and completely a Bolshevik organization.
Yeah, drink.
Defines integrated health services as the organization and management of health services so that people get the care that they need when they need it in ways that are user-friendly, achieve the desired results, and provide value for the money. That's the stupidest definition of integrated health services I've ever seen, but that's the WHO for you.
I don't know. I like the doctor where it's all in one. You just go there, you talk to him. He says, okay, well, you go, they're going to take your blood down the hallway.
Yes.
You need an EKG. They'll do that down the hallway and you get results immediately. The doctor looks at it and he says, yeah, you're good, or no, you're fucked up.
Now, here's the thing we mentioned earlier about your subscription to your life. The U.S. population is becoming more unhealthy. According to the CDC, 6 out of 10 U.S. adults have at least one chronic disease. Really?
Go through the list.
Chronic diseases include asthma, heart disease, high blood pressure, diabetes. While they may or may not be rare, illnesses like these can result in higher healthcare costs. Patients with chronic conditions often need long-term care that's complex and intensive. This includes more prescription drugs, emergency services, in-home care, and support programs. But these all come with a high price tag. The one that they do not tell you about that they love to give you is SSRIs.
Yeah, talking
the
about
psychotropic drugs.
Yeah.
They
love that at the VA.
Yes, there is an entire industry out there to get people onto those drugs. That is the purpose of their industry. The psychologists and the psychiatrists, they're not trying to help you anymore. Find me one person that has been cured by a psychologist or a psychiatrist. Find me one.
Yeah, you're right. Like when I had my TBI, I remember I went through the whole Walter Reed craziness.
Yep.
Then I came back here in the States and they were continuing my SSRIs that I got at Walter Reed. And I was talking to one of the Army doctors around here and he goes, well, you're going to have to be on this the rest of your life. And I'm like, no. He goes, no, you have to be on them. I'm like, I'll take them for a year. It's a crutch. I understand. You know, my thinking meat got scrambled up and it's healing. And we got to take some pressure off of it. I'm cool. It's just like a crutch. But, you know, at 1 year, I'm weaning off of it. He goes, well, I can't recommend that. I go, I don't care what you recommend.
Yeah.
I am not going to stay on head meds for the rest of my goddamn life.
Yep. Absolutely correct.
And then I went to the Walter Reed or the Fort Drum TBI clinic.
Yeah.
And they were trying different, you know, TBI or SSRIs and other head med kind of things to deal with my migraine headaches. One of them almost blinded me. Like I woke up in the morning and everything was amber colored. Like I was looking at the world through an old amber monitor. And I was like, nope,
hard pass.
Yeah. And I remember I shouldn't have drove, but I got in my car. I called my chain of command. I'm like, we're going up to the head clinic at Drum. Like, okay. Drove the 3 hours up there, walked in and said, what the fuck is this?
And
they're like, oh, well, it's a side effect of such and such. I'm like, no, I'm not taking it anymore.
Yeah. Here, you can have this shit back.
So I'm very, very, I don't mess around with that shit at all because I want to risk it.
So, like I said, Mrs. Battle Dwarf knows all of the drug stuff because she sold the wholesale stuff. And she showed me where Xanax, you're only supposed to be on it for 6 months.
Yeah.
It is not meant to be a permanent drug.
Because it becomes very hard to come down from that. Like Jordan Peterson.
Yeah.
He had to leave the country, go to a specific special clinic. I believe it was in Russia.
Mm-hmm.
And he almost died there.
Yep.
Taking him off Xanax.
Yep.
Or something similar to it.
Yep. Now, here's the other thing. They don't cross-test any of those drugs either. Once they put you on them, they just give you all of these. Nobody knows what, if you mix drug A, B with drug Q and X, if you mix those 4 drugs, they don't know what's going to happen. They have no idea, which might give you other health problems. Oh, look, you've got another health problem. Here's a drug for that. See how this works? It's the subscription to the rest of your life. You would spend your life medicated and chronically in pain or messed up in the head.
Yeah.
Or crippled in some way.
Listen, like my situation, I mean, I know I'm becoming pre-diabetic because my fasting blood sugars are just a pinch too high. And I'm not screwing around with it. I am hitting that shit hard to reverse it. I'll probably do a whole show on it and show my diet and all the supplements I take and the PT I have to do to maintain.
You're out of years.
I am out of years, but I want to have a slower slide down to my grave at 65. I don't want to be miserable between like 56 and 65.
I don't want to be gibbering blinded.
No, I don't want that. Mm-hmm. I want to be like one day doing my thing, go,
sure,
and hear the voice. You're done. Oh, okay.
Okay.
And that's it. You know?
All right, let's go then.
Lead the way.
Watch Grunt Speak live every Tuesday and Thursday at 8 p.m. Eastern. And if you want to join Pop for Supporters Sundays, go to redonkulous.com/donate and make a monthly pledge. A link is in the Meat Gazer box.